Just on the subject of the 16-year-old girl we talked about a moment ago, what happens if a 16-year-old says, no, I want osteopathic or chiropractic treatment, but a parent or both parents say, no, I don't think you should have it?
The way in which that has been dealt with, as far as the law is concerned, is that when the so-called Gaelic competent child, or the child who is 16, not quite 18, is saying, I want to have treatment, the focus is going to be whether the treatment that she is agreeing to, or she or he is agreeing to, is of benefit to that 16-year-old. If the parents are saying no to that, then they can challenge that if they want to. But if in the meantime you're dealing with that 16-year-old and you think that the treatment is beneficial to that 16-year-old, and the 16-year-old does need that particular treatment, you can go ahead and provide that particular treatment, whilst the parents can challenge that. I think the issue in terms of 16-year-olds becomes more difficult if it was the other way around, in the sense that the parents want her to have the osteopathic treatment, but she doesn't want to have the osteopathic. Right. So she's refusing the treatment. So then the parents will have a say in terms of whether she can have that treatment or not. Jonathan?
Yeah, I wouldn't treat a child that's not giving consent, regardless of the parents' views, frankly. I think that's far too dangerous going forward. But yeah, I completely agree. I mean, it's a question of capacity, it's a question of Gaelic competence, it's a question of assessing the child on the day. Again, from a realistic point of view, I mean, when you're dealing with osteopaths and chiropractors, you're dealing, without any way of meaning to demean the professions, you're not dealing with life-threatening scenarios that require urgent decisions to keep a child alive necessarily. You might be able to improve the quality of their movement, biomechanics, etc., their life. But if you're faced with a situation where you have that triangle of parents and children and everyone's disagreeing, the safest thing to do is tell them to go away and sort it out between themselves and come back with a cohesive view from a complaints point of view. I appreciate that doesn't necessarily give the patient the best outcome. But when you're dealing with complementary therapy, I don't personally see there's much merit in taking on that situation unless you really have to.